let's say, from the region, if I can talk about the Middle East. So that's why I want to I want to talk morely about ethical and legal imperative for AI integrated in education and in practice. Why I chose these two, education and practice? Can you go for the objective, please? I use the both because as we are teaching the student and they graduate, we want them to be as safe using this AI unless they can go and apply it in clinical practice. So first I'll go with the introduction about the globally and Kuwait perspective of AI, and then define what ethical and legal foundation of AI. And then I'm going to explore a little bit about the trend about AI using in clinical and practice. I know most of us, they are knowing now these days how they are using, but we want to focus more how that impact on our daily practice, either in education or in clinic. Analyzing Kuwait current position AI adaptation, and then how this ethical challenges and risk can impact on nursing, and highlight the legal requirement. I know we have so many things, but we have to say and loudly what the legal requirement needs to regulate in Kuwait. And then what the outline strategies and safety, because usually whatever we are doing, research, studying, modified according to evidence base, you want to work in a safe environment. We want our patient to be safe, as well as the staff to work in safe environment. Proposed roadmap, as I mentioned here, roadmap, it might be a little bit of what the ethical and legal. As the introduction here, globally, you know what the worldwide by AI can enhance clinical decision making and patient monitoring and workflow efficacy. And then efficacies, and then we can talk about the education is adopting AI as we are using now labs for day. We are using for simulation lab, high fidelity, low fidelities, virtual patient, adaptive learning, and automated of assessment. So every day, I think in education, we are using this unless we can know what the globally are doing, unless we can use it in safe manner. According to international bodies, WHO, ICN, ANN, they are emphasizing patient safety and ethical and transparency and accountability for establishing this principle. Once we are talking about this, that means we want to reduce the errors. We want to support critical thinking and prepare nurses to work in a future with the health demands. Next slide, please. In Kuwait, as we have now a new vision for Kuwait in 2035, like we call it New Kuwait. A New Kuwait these days, they are emerging the healthcare throughout smart hospitals, electronic health records, decision making and support, telehealth platforms, and how we predict and analyze emergencies in critical care. So according to our college, College of Nursing in Kuwait page, we are using AI to supported stimulation and digital learning tools. Like we can use that one and clear, unless we have a clear guideline, ethical guideline, legal regulation, and safe training, and then we can prioritize that in the healthcare and cultural value. Cultural value is very important. We can adapt from other countries or other nations they are using AI, but still we have shaped it and mapped it according to our cultural values. Next slide, please. The ethical legal, as we can mention, usually we are teaching, as I mentioned here, for educational part. Everyone knows that. I know it's like always we are talking about autonomy, beneficence, and maleficence and justice. But what about the key point we are talking about? How we respect the patient, how we are taking care of giving a good quality care, and how we prevent the harm, and how we should ensure that fair for all. So all that can be given as example in how we apply by giving a suggested treatment plan, early warning system that can use with AI. AI also can give an algorithm, and also I have to mention this algorithm should be match or merge with our cultural values. Next slide, please. Okay, let's say about the legal foundation in AI and education and practice. So legal, we are talking about the data privacy and confidentiality, and about also liability, also about the transparency with the patient. Are explaining everything? Are they are accepting using this digital health? This AI, when we are embedding this AI in education, are that protecting patient data? Are they are responsible for the decision that applying for us, and up on that we are taking our decision. So all of that should be clear enough with our regulation. Next slide, please. Okay, I think I cover mostly with like nursing education and nursing practice about the trend they are using a virtual lab, learning platform, feedback, and then for decision support and the clinical. When I say about the decision support, sometimes we are using these apps or we are using this whatever they applies in the hospital these days. They are kind giving a hands-on, as I mentioned. But what about did we stop a while and we think about this decision making that apply for my patient or not? Because the AI, they don't know exact who I'm applying with, who I'm talking with, taking care of as a bedside. So I have to go for this decision, and then I have to map it for my patient unless can be in safe decision making. And also AI these days can predict, like mostly now I saw a bunch of studies they did how they can predict patients' falls, which is really excellent. But can we apply it? That I can rely about AI that can then predict and alarm that the patient might be high risk for falls, and then I can apply my agenda that I have to take care of this patient. Can I rely on this or not? So this is one thing we have to put in our consideration. A smart documentation, like is very important this day. I think most of us we are using even in education. For me, I'm using mostly like how we use voice to text. We don't have now as the trend is very fast, the days is very fast. We have a lot of text to finish. We are using this voice to text, but we have to finalize and review whatever we wrote as documentation because this is an evidence is used in daily practice. Telehealth is very important. I think telehealth is like on patient education. Sometimes we cannot contact patient if they are far away from the healthcare setting, or sometimes they need minor discussing or whatever. I think this is very important, but this one should be updated, rely on the cultural belief, values of the country itself. Next slide, please. Yeah, here is I mentioned all of that, just I made like a summary. Can you go for next slide? Kuwait education, current position. Yeah. So now I want to talk just more depth in Kuwait education, like as we are adopting AI. So I mentioned again, according to New Kuwait, everywhere now they are asking, even when for my department, I have now to build a strategies on and imagine like these three strategies, all of them about AI and about the stimulation lab, about the like health, the virtual hospital, smart hospital, all this is AI. But how can I rely on this and bring my student in this to be as educator as they get their knowledge from this, unless I have clear ethical and clear legal that can protect our college, can protect the student unless they can graduate. So this is need a lot of progress, educational progress. It need a lot of studies. We cannot say I will do this one without refer to studies and research. I can say we have a limited research. There is no clear comprehensive studies describing how this AI currently adaptive. So if there is no clear, so we are lack of all of those. I cannot rely on this unless I establish with the research, get evidence based, and then from there I can build my strategies. Really, which I want to mention here. Now, most of my studies, like proposal or the research that I want to apply, I cannot make any program or input any AI in the curriculum in our program unless I can make a limited number of research. Based on that, I can make it like as evidence that we need to establish that in our curriculum. If we can go for next slide. In the practice, again, daily practice, as we are sending patient there, we want to make sure that we are aligned. We don't want to be in the healthcare provider as behind the clinical. So we want to make sure that we are aligned and fill the gap with the evidence from the clinical practice. And also here, there's a lot of challenges. There is a lot of like ethical challenges. We have to have are we protecting the patient records? It's clear without transparency of the policies. It's hard to do it. There is no even national nursing guidelines for AI using. I know by the trial we are practicing, we are going with, we are doing, we are dealing with AI. Even now, most of the theaters in Kuwait now they are using AI and they are using that in the theater. But what about the nurses? Are they are qualified enough? Are they are protected with these rules, with this legal? Still is not clear in Kuwait. So again, the basis and accurate of the outcome, still we need a feedback of that after we establish at least. If we can go for next slide. Judgment, humanity, and judgment should be clear enough, depending on too heavily.
دكتور حنان، صوت يا دكتور حنان، حضرتك معانا؟ بس دكتور حنان سامعاني؟
We are there.
Yes.
Yes.
Okay, now
I'm still on the ethical. Yeah, I think it's good. Okay, let's say about the legal requirement needs. We are really needed for data protective laws. We want to know what the law is shaping this AI when using either in education or a clinic. Also, guidelines from Ministry of Health on digital health tools, and also based on medical devices or software, as we need to approve and regulate that. Also, to ensure that algorithm everywhere, but how we are shaping this algorithm according to which criteria, according to which like map we can transfer this algorithm in our daily practice. The ethical guideline, I think this is like a huge red flag is raised when we as a staff nurse using the AI, and also the patient privacy, and also how we can monitor and evaluate if there is some error or there is some issues that we are looking for this AI outcome. Also, we have to follow and compliance with the international standards, as I mentioned, according to WHO, ICN, and other recommendation, and we have to follow these recommendations. Just I want to mention again, as this legal regulation, they are protecting data, as they are making the ethical use clear enough, and is that ethical consideration is mapping with our daily practice in the clinic, and how can I bring that from the clinic to our student to make it this is the real life. This is like what they are using in the clinic, unless I can bring it in my curriculum to be aligned with the Ministry of Health. Can we go
Dr. Hanan?
for strategy?
Dr. Hanan?
Yeah.
1 minute.
I'm there. Okay.
1 minute
Can
with
we
you.
go for, okay, can we go for the need? Slide on need. Hello? Then conclusion, please, on the conclusion. No, move that one. Conclusion. Yeah. Yes. So in conclusion, I just want to wrap up. I want to make sure that ethical and legal AI implementing in the nursing for sector-specific guideline, integrated ethical and nursing curriculum, and also to regulate and monitor all of the enhanced safety, safe decision making, and also privacy of the patient. Globally, we should roadmap align with international about the AI as we have a clear framework and a model. And this is like take out message strategies, ethic, and legal compliance with AI integration, strengthen education nursing practice should be safe and aligned with our ethical and legal consideration. Just if we can go, just I want to say thank you before I leave. Just I want to go through this empowering nursing student and by using ethic through our clear policies, strong oversight, and continuous training that can make safe environment for patient and safe environment for students and nurses when they graduate. Thank you. I want to say thank you of all of you.
Thank you so much, Thank you so much, Professor Dr. Hanan,